Today we're going to be doing an eye assessment on my patient here, Allie. Do you have any concerns about your eyes today?
No.
Okay. Have you had any changes recently in the last 6 months?
No.
Okay. So first we're going to take a look at Allie's eyebrows. We're going to note that she does have some thin hair and is brunette. There's no nodules, lesions, or scaling that we can see. We're going to take a look at her eyelids. We're going to see that they do close all the way. We're going to see that there's no lesions on the rim. There's no exudate or scarring. Have you had any irritation to your eyes recently?
No.
Okay. And then we're going to take a look at her eyelashes. They are thin in nature. They do point upward. I don't see any that go into her eye that might be bothering her. Have you had any changes in your eyelashes recently?
Mm-mm.
Okay. We're going to do an overall assessment of her eyeballs. There's no lesions. They're not reddened. They are white. They're moist and glossy. They're not sunken in. We're also going to see that they do have a good curvature to them. Have you had any drainage from them recently?
Mm-mm.
Okay. Take a look at her sclera and her conjunctiva. So we're going to pull down just a little bit to see that it is pink in there. There's no white. Have you had any drainage recently? No? Okay. So her conjunctiva does look really good. It is moist. She doesn't have any swelling. No drainage from it. Take a look at the sclera. We do note that it is china white in color. There are some blood vessels that we can see, but nothing concerning. It is glossy and moist. Have you had any dryness recently that you might be worried about?
No.
Okay. We're also going to take a look at our lacrimal glands. I'm going to palpate the lacrimal gland on both sides. Are you having any pain while I do that?
Mm-mm.
Okay. Have you had any swelling or redness over the past couple of days? Okay. There's no swelling or redness noted on her assessment either. I'm going to palpate her orbital ring. There's no edema, swelling. Is that tender whenever I palpate?
No.
Okay. So we're going to see how Allie's pupils respond to light. We're going to take a flashlight and look at her eyes and see if they constrict whenever we flash the flashlight at her eyes. Okay. They are reactive. We're going to do this side and see. Okay, we're going to do this side. Alright, so they are equal. I would say they're about a 4 millimeter size. They're round and they do react to the light. Both eyes do constrict whenever the light is shown over one eye and the other one is not receiving light. Now we're going to do an accommodation test. So I'm going to take my finger and move it toward and away from Allie's eyes, and we're going to see that her pupils constrict and accommodate to where the object is and how far it is away from her. First we're going to start far away. We're going to go inward. Okay, and back, and we'll do one more time. Alright, good. We're going to check Allie's 6 cardinal fields of gaze. I'm going to have her follow my finger. So we're going to go up. So what we're looking for is to see if she follows it symmetrically and if there's any nystagmus. So I don't know that there's any nystagmus. She followed them really well. Didn't have any trouble with that at all. Check her corneal light reflex. We're going to shine a light into her eyes and see where the light reflects on her cornea. Alright, looks about the same. We're going to do the uncover cover test to see if there's any change in her pupil size. So first we're going to do her left eye. Hold about 1 to 2 seconds, see if there's any change for strabismus. No, the right. Alright, didn't see any change in her pupil size. I'm going to have the patient hold this about 14 inches from her face. Cover one eye. Hold for you. Just read the sentence.
This test screened for loss of peripheral vision. It compresses the patient's peripheral visions with your own, assuming that yours is normal.
Okay. And then the other one.
This test screens for a loss of peripheral vision. It compares the person's peripheral vision with your own, assuming that yours is normal.
Okay. So the patient looks like she's got 20/20 vision in both eyes. That concludes my eye assessment here on my patient Allie. Thanks for watching. Do an ear assessment on Allie. First, we would look at the ear on the outside and note that there's no lesions, and her ear is normal shape. The cartilage is thick. There's no skin issues around her ear. We're going to take a look at the other side. Same on this side, they are symmetric, and her earlobes are connected. We would take an otoscope and look into the ear. We would pull back the pinna up and back to look at the eardrum and note that it is gray. Gray is within normal limits for a patient. If it's white or reddened, has any exudate coming from it, then that would be abnormal. Another part of the ear assessment we're going to do is palpate her mastoid process for any nodules, lumps, lesions, or swelling or edema. So we're going to do both sides at the same time. Just back here on this bone. I don't feel any lesions, no bumps. Have you had any pain with that?
Yeah.
Okay, sounds good. Alright, we're going to be doing the whisper test here on my patient Allie. I'm going to whisper a couple words and letters to her. She's going to cover one ear, and then I'm going to do the whispering to see if she can hear clearly in both ears.
5 H T
Okay.
J R S.
Okay. The other test that we will be doing today is the Weber and Ryan test. These both use a tuning fork, but since we do not have a tuning fork, I'll just explain both of these tests. So the Weber test, you take the tuning fork and you make it ding, and then you put it on the center of the patient's forehead and see if they hear it equally in both ears or if they hear it one side is louder than the other. And then the Ryan test is when you take the tuning fork and you make it ding and you put it on the mastoid bone behind the ear, and then after a few seconds you bring it up right next to the ear to see where they hear it better. That's going to conclude my ear assessment here on my patient Allie. Thank you for watching.